What do tumor markers tell us about cancer treatment? Imagine a tiny signpost inside your body that can tell doctors a lot about your cancer. That's what tumor markers are, substances produced by cancer cells or by your body in response to cancer. They float around in your blood, urine, or saliva, giving clues about what's happening inside. These markers are powerful tools that help doctors understand the nature of the cancer, decide on the best treatment options, and see how well treatments are working. They are especially important in managing reproductive cancers like testicular and cervical cancer, where they help with diagnosis, prognosis, and monitoring. Tumor markers are like biological signposts that reveal details about the cancer's behavior. They can be proteins, hormones, or genetic materials that indicate whether cancer is present and how aggressive it might be. But they don't usually stand alone for diagnosis. Instead, they work alongside imaging tests and physical exams to give a fuller picture of the disease. For example, in reproductive cancers, these markers can tell us whether the cancer is likely to respond to certain treatments or if it's more aggressive. One of the most important uses of tumor markers is predicting how a patient will respond to specific treatments. Different people with the same type of cancer can respond very differently. Tumor markers help identify which patients are more likely to benefit from certain therapies before treatment even begins. For testicular cancer, two key markers are alpha-fetoprotein and beta-human chorionic gonadotropin. If these markers are high at diagnosis, especially above certain levels, it often indicates a poorer prognosis. For example, very high levels of alpha-fetoprotein exceeding 10,000 nanograms per milliliter or beta-HCG above 50,000 milli-international units per milliliter suggest a more advanced or aggressive disease, with about a 50% chance of 5-year survival. On the other hand, lower levels usually mean a better chance of cure, often over 90%. This helps doctors decide how intense the treatment should be. Tumor markers also guide targeted therapy, which is a more precise way of attacking cancer. By testing the genetic or protein makeup of the tumor, doctors can see if specific mutations are present. For instance, if cancer cells have mutations in the epidermal growth factor receptor gene, doctors might prescribe drugs called epidermal growth factor receptor inhibitors. In breast cancer, markers like human epidermal growth factor receptor 2, estrogen receptor, and progesterone receptor help determine whether hormonal therapies or targeted drugs will be most effective. Additionally, markers like PD-L1 expression and tumor mutational burden can predict whether a patient might respond well to immunotherapy drugs that help the immune system fight cancer. Monitoring treatment effectiveness is another vital role of tumor markers. During therapy, doctors measure these markers regularly. If levels go down, it usually means the treatment is shrinking the tumor. If they go up, it may signal that the cancer is progressing or resistant to treatment. For testicular cancer, measuring alpha-fetoprotein and beta-HCG levels during and after treatment helps assess whether the therapy is working. If these markers don't decline as expected, it suggests the disease might be resistant, and treatment plans may need adjustment. In some blood cancers like chronic myeloid leukemia, highly sensitive tests measure the BCR-ABL gene mutation to see how well the disease is controlled. Tumor markers also help in predicting the overall outlook or prognosis of the disease. They can tell doctors how aggressive the cancer might be and whether standard treatments are likely to be successful. For reproductive cancers, this information guides decisions about how aggressive the initial treatment should be and how closely patients should be monitored afterward. It also helps patients understand what to expect and plan accordingly. Of course, tumor markers are not perfect. They have limitations and should never be the only factor in making treatment decisions. Cancer can change over time, and markers might not always be present or may fluctuate. Sometimes a marker level can be normal even if cancer is still there, or high levels might not always mean the cancer is progressing. Also, some markers are not specific enough to detect early-stage disease or screen the general population effectively. For example, the marker Ca1-5 in ovarian cancer has a high false positive rate, which can lead to unnecessary worry or tests. In the context of reproductive cancers like testicular and cervical cancer, tumor markers are essential parts of the management process. They help with diagnosis, guide treatment choices, monitor how well therapy is working, and catch recurrences early. Combining these markers with physical exams and imaging creates the most complete approach to care. As science advances, new markers are being discovered that will make treatment even more personalized and effective. Always remember, discussing these options with healthcare professionals is key to understanding what's best for each individual case.